my name is Kelsey Burke. I'm originally from Portland, Maine, but I'm currently living in Wakefield, Rhode Island, so right around the corner from URI. I graduated in 2006 with my PharmD, and I chose URI primarily because I was really intrigued by the fact that they only had one program. So it was a 6-year program altogether, but you basically were able to apply in the beginning, and kind of as long as you were able to keep your grades up and keep a good standing in the college, you were kind of able to do the 6 years all together, as opposed to some of the other universities that I looked at that you kind of had a 2-year introductory period and then had to reapply to the pharmacy program. So I didn't really like that aspect. I liked that at URI you were able to apply, get into the pharmacy program, and from day one know that you were kind of working towards that goal, which I thought was really, really appealing. But also for me, like, the campus is absolutely beautiful. The facilities, especially now, are amazing. They're state of the art. People that go there are going to have like top of the line education, especially for pharmacy. So it just was like a no brainer for me choosing URI for pharmacy. It's honestly was one of the best schools in the country as far as I was concerned. So that's primarily why I chose URI.
Awesome. Well, thank you for that. So where do you, so you work at Omnicare, you
I do,
said.
yeah. So I work at Omnicare. My role right now is dispensing pharmacy manager. So that kind of has a lot of different, I wear a lot of different hats on a day-to-day basis. My primary role is to dispense medications to elderly patients that are living in, nursing homes or short-term rehab centers. But we do a lot of different things at Omnicare. It's not just long-term care. That's primarily what we do, but we also service a lot of different facilities around the state. So we also deal with homes that have pediatric patients, patients that are at short-term rehab facilities that are looking to just kind of recover maybe after a surgery and they're just not well enough to go home. So there's a lot of different facets within Omnicare, but primarily long-term care and nursing home residents and patients that are on more in the elderly population.
Awesome. So what does a typical day at work look like for you?
So typical day at work for me, it's nice because it really changes on a day-to-day basis. So I'm never really doing the same thing every day. Primarily, my job is dispensing medications again for the elderly. So that's checking medications, verifying that it's correct patient, correct drug, that everything that's ordered from the doctor or the hospital is correct on our end as far as dispensing to the patient. Also kind of doing a lot of the clinical work with that in terms of making sure that there's no drug interactions, allergy information, that therapy is appropriate for the patient, it's dosed correctly, all those kind of things that would be similar to like a retail setting or in a hospital when you're verifying meds. So that's primarily what I do day in and day out. I also have, management responsibilities as well. So payroll, scheduling. I work a lot with the other pharmacists at the facility, developing them, helping, really hone their skills too. So that's a lot of what I do, is working with the other pharmacists, managing us as a team, not only from the dispensing side, but also kind of helping them to develop and helping them really craft their skills as well. And then there's some other projects that I work on. So some teams that I'm part of in Omnicare, in terms of like innovation, and we work on like projects that help to kind of change our operations or better our way of doing things. So we meet and meet periodically and kind of discuss those things as well. So there's a few different things that I do, but primarily would be dispensing medications and making sure that they're safe for people in the nursing homes.
That's great. So what do you think is the most unique part about your job compared to other settings like hospital, retail, kind of the traditional pharmacy roles?
So what I really love about long-term care is that no day is ever the same as the day before. I get to do something different every single day. I'm not stuck doing the same thing day in and day out or performing the same task. I'm constantly moving around to different departments. I really think long-term care is a great hybrid between retail pharmacy and hospital. It's really like a unique mix of both settings. So on any given day, I could be checking, a typical blood pressure medication for somebody. And then the next moment, I'm looking at a very complex infusion, treatment for somebody. So it kind of bounces all over the place, and you really get to exercise skills in a lot of different facets of pharmacy, which is just fascinating and keeps you really sharp, keeps you engaged, and keeps you really interested in what you're doing. I get to kind of dabble in a lot of different things. So I'm, dispensing on one side, but also working in an IV department or doing compounding in another moment. So it just kind of gives you a lot of variability on a day-to-day basis that you may not get in a lot of other settings.
Yeah, I really liked that when I was on my IPI. I noticed that it's I feel like you could it's like half hospital, half community in a
Yeah.
way.
Yep.
So,
Yeah, you get to
I
do a lot of different things, which is great. I mean, if you had told me that I would be like working in or even running an infusion department, like back when I, was in pharmacy school, I just would have thought that that was something you would only find in a hospital setting or at an
Mhm.
infusion center. So to be able to be in a location where you have that as an option, and if you want to learn about it or you want to really, dive into that aspect of pharmacy, you have that available at your fingertips, which is just so great from an educational perspective and keeping your skills sharp.
Right. That's awesome. So I remember when I was on my IPI, Jada was telling me about how the pharmacists have overnight on-call shifts. So did
Yeah.
you want to talk a little bit about that and how
Yeah.
that works?
It's definitely an adjustment. I mean, now that I've done it for long enough, it just kind of becomes part of your life, really, more than just like anything else. But coming from retail previously, it was definitely something you kind of have to adjust to. Getting used to the fact that, in retail, a lot of times you get to kind of, you may have a crazy day, but at the end of the day, you kind of can leave it in the pharmacy and you know that somebody's taking over for you or relieving you. Whereas in long term care, there are a lot of places where you'll have that overnight on call where you could potentially get a call at 2, 3, 4 in the morning and have to address it. The nice thing for us is a lot of what we do overnight can be done from home. So, it may be just a quick phone call back to the facility, answering a question, doing something on the computer quickly to kind of approve whatever they need. So it's not necessarily that you're up all night or running back and forth to the pharmacy, but definitely the potential still there. I think, as long as you try to keep in mind that there's a patient at the end of everything, every script, every phone call, it really kind of helps to keep things into perspective. So you're realizing that what you're doing, it may be in the middle of the night, maybe it's a little bit inconvenient, but it's really to kind of benefit somebody that may need something that's life saving or, so that kind of helps keep things into perspective. And again, it just really becomes part of your life after a little while. And I'm so good at just kind of being able to get up quickly and go to bed quickly and kind of just roll with it. So it really is not, I would say, a major concern. It's definitely something that you have to get used to and that you're conscious of, but not anything that would deter me from working in long-term care, certainly.
Right. I know. I thought that was so interesting when I found that out that you guys do that as like long-term care pharmacists because I had never known that in the past and I was like, that's pretty cool. I mean, I've always just thought of like on calls as, like doctors or
Right.
on call or whatever, but that was the first time I had ever heard of it. So it's pretty cool.
Yeah, it's honestly like, I mean, some nights you might have a few calls that you have to address and it kind of, you might be up a little bit more, and but a lot of nights there's no phone calls at all and you kind of get a normal night's sleep and it really doesn't make too much of a difference in your life. So it's kind of, one of the things, again, you just accept that this is a 24-hour business and healthcare is 24 hours. People are going to get sick 24 hours a day. And if they need you, then it's kind of, you got to answer the call of duty. So um, that's how I look at it.
Right. Yeah, that makes sense. So did you do a residency or any special training before Omnicare or did you just
No, so I didn't do a residency. My only really, I guess, formal training and really was more informal was just doing a lot of geriatric work through URI. Um, so just in school, I did a like geriatric rotation. Took the geriatric elective. I did some work with a geriatric. gerontology society outside of, URI too. So I kind of prepared myself a little bit that way. But when I left URI, I went straight into retail, which is where I had been working like as an intern. So I worked in retail, a community pharmacy for about 2.5, 3 years after graduation. So I really didn't think that my long-term care career was an option really. I ended up getting hired by Omnicare after working in retail with really no experience in long-term care other than having done like a rotation and just kind of having been exposed to Omnicare, kind of similar to like what you did. So I didn't do a residency. I didn't have any like specific formal training going into the job. Um, so I ended up getting hired there. I was a dispensing pharmacist for about a year and then actually took over and managed their infusion department for 4 years. Again, I didn't have really any infusion training formally other than just through school and through rotation. So it was a lot of learning on the job, a lot of self-taught education. And now, being back like in the dispensing pharmacy, I thought that it would be really important for me to kind of take the next step in my career in terms of education. So I just recently passed my board certification.
Oh, wow,
So
congrats.
yeah, so that's exciting. So now I'm a board certified geriatric pharmacist, which is a certification that'll be good for 7 years. And there's things you can do to kind of keep that going. But I did want to have a little bit more formal training under my belt, just because I thought it was important to kind of keep working on that, keep expanding my knowledge, keep honing my craft, working on those skills, keep myself sharp. So that's an exciting thing that I've been able to do kind of on my downtime, and really want to keep working with those societies and the board of pharmacy to kind of keep that going. So
Yeah, that's awesome. Good for you.
thanks.
So in general, how do you feel that URI prepared you for the role that you're currently in?
Um, I mean, URI was fantastic. I thought their education again was just top of the line education. What I think was really great about URI is it's not just them giving you, a bunch of information about drugs, because you're never going to be able to know every single little thing about every single drug. It's just not possible. But what URI really excels at is being able to teach you how to use your resources and how to interpret information so that you can use that on a daily basis. It's really important to be able to look at primary literature or, a drug database, and to look at the information and be able to apply it to your practice, because without doing that, it really is just a bunch of information that really anybody can regurgitate. So I think URI really prepared me to be able to evaluate a lot of those resources and that information to be able to then interpret it and use it in my daily practice with my patients, and to put it in a way that other healthcare providers and patients will understand as well. Because again, just kind of spitting out drug information is great and you'll be really knowledgeable, but being able to use it and interpret it and make clinical decisions based on that is really important. And I think URI really just does a fantastic job of preparing you in that way, as well as giving you a lot of the background information about drugs and what you need to know, as a foundation as well.
Right. I agree with that for sure. I feel like Dial, it was the most helpful
Yeah,
class ever.
yeah,
And I
definitely.
never, taking it was not great, but
Right. It's
realizing,
a hard class, like for sure, but I mean, so much of the information that I've learned, there's always things that you'll remember and pick up on throughout any of your classes, but the dial information, you don't realize at the time when you take it how valuable and how important it is. I mean, even me just studying for my boards, having that basis of like understanding what primary literature was and being able to look at a study and interpret it and evaluate it, is just a skill that you really need to work on. And so that's why I think you or I really did a great job of constantly exposing you to that, and whatever class that you were in, whatever topic you're talking about, always kind of came back to that core dial information, so that when you're out in the practice setting, you're not going to have like a textbook on hand all the time. You're not going to have a drug database, at your fingertips every second. Hopefully you do, but what do you do with that information? How do I apply it to my patient in front of me right now? What does that really mean and look like? I think is just such an important thing that URI really helps to prepare you for.
oh yeah, I definitely agree with that. So the last question I have is, how do you see the role of long-term care pharmacy evolving in the future?
So, my thought is like anything, I think pharmacy is probably going to move towards a much more clinical, we're going to be much more clinical in nature, I think, going forward. I think eventually automation will be such a bigger part of what we do on a daily basis in terms of dispensing, packaging drugs, all of those kind of manual production processes are going to be much more automated. So I think it's really important to keep your clinical skills, sharp and keep working on that aspect of your career because as we move forward in long-term care, I think the clinical consulting aspect is going to be a lot bigger. So what the consultants do in terms of looking at a patient's chart, medication therapy management, all of those kind of recommendations that they make based on patient demographics and, lab results and interpreting labs and all of those things, I think are going to be a lot more important going forward. So having something like a residency in your back pocket or, even a board certification, I think is just going to be more and more important as it moves towards a more clinical um, clinical role, I guess.
Yeah, definitely. Definitely. All right. Well, those are all the questions that I have. Was there anything else that you wanted to add that I didn't ask about or
Um, no, I mean, I think that kind of covered everything. I'm just hoping that people get a sense of like long-term care as being just a really unique hybrid of kind of a lot of different situations that you have the opportunity to do a lot of different roles. Um, and that if you're really not sure if you like retail or hospital, or maybe you like both, or maybe you like certain aspects of both, long-term care is definitely a really great option for people that want to have a little bit of everything, and that want to be fast-paced and want to keep learning. I mean, every single day we get patients that are on meds I've never seen or have unique diagnoses that you've never seen, especially throughout the pandemic. I mean, we've been able to do so much with treatment and working with our long-term care, facilities to kind of make sure that patients are getting the best and most up-to-date and current treatment possible. So it's really like an exciting time to be in long-term care. But I just think people don't really know about long-term care. It's one of those kind of secret hidden parts of pharmacy that I hope people have a little bit of a better sense of now. So
yeah, I know that I didn't know a whole lot about it, so I was glad that I was able to do my IPI there because, you know, everyone else did theirs at a hospital, but I got to see something that was a little bit different.
yeah,
So, I'm definitely thankful that I got to learn more about it.
yeah. And I mean, quite honestly, the population is aging. I mean, we have a whole bunch of baby boomers that are now going to be working their way into elderly status. So I just think it's great to be kind of a little bit ahead of the curve and to know that there's a lot of people that are going to need our help and our expertise when it comes to drug management and their drug therapy going forward. So, of
Thank you so much.
course, no problem. Have a good
Alright.
one.
You too.
All right,
Bye.
be cool. Bye.